Hey folks, Damon here, founder and director of Asheville Family Fitness and Physical Therapy. Welcome to my back deck. We are in now week 3 I think of coronavirus quarantining, and I've been spending a lot of time out here on my deck trying to stay safe, and I hope you are too. So I wanted to share with you all today a morning routine that I do pretty frequently. I call it waking up my house. And it's a way for me to wake up my body and just get my joints moving and get my fluid circulating, get my blood flowing. But also it's a way for me to scan my body and see what feels stiff or what might be developing into something that I need to keep an eye on. A way for me to monitor kind of free movement, both of the joint tissue, joint structures, and the soft tissues around the joints. So as we go through this movement sequence, it takes me about 10 to 15 minutes. As I work through it, I'm working each joint, and it's basically its functional range of motion. So I'm seeing how does that joint move today compared to yesterday or the day before. It's a way to work out soreness from something you did a day ago, 2 days ago, or some new activity maybe where you're sore or a little bit more stiff than usual. And also it's a way for me to gauge symmetry from one side to the other. So I'm always asking myself 3 questions. Does it feel like it's moving normally, or does it feel stiff or stuck or working towards getting to that place? Does it feel symmetrical to the other side? And then I'm always just keeping a mental note of any new noises, clicks, pops, grinds, catches, anything like that. But quick disclaimer, please, if you have active pain or a spot that's not getting better or it's getting worse, or certainly if any of these movements make it worse, don't push through it. Stop, make note of it, and then take that to your practitioner. Of course, I recommend physical therapists. We have a team of great PTs at our facility in West Asheville, and I highly recommend if you are having a mechanical problem or a movement problem that's not getting better, or you're having a real active pain response that's not getting better, to not push through, to go see somebody and let them evaluate your mechanics and then give you a recommendation. If you find a spot that is kind of sticky or stiff, stay in that movement for a little while. You're welcome. I'm going to kind of move through these quickly, but you're welcome to stay there as long as you want. I'll do that if I find an area or a spot that feels sticky. I'll just kind of stay there for a bit and just not force it, but just stay in that movement pattern and just see if over 10, 15, 20, even 30 repetitions, if it starts to loosen up. Sometimes I'll even come back at the end of the sequence and go back to that same motion again and just see if I can loosen it up more, or just kind of check in with it and see how it feels. So hopefully this helps you in those ways. So we'll get started. So the first thing I do, by the way, you just need to find a clear area with no obstacles. You don't really need anything special. The more slick the floor, the better. You see that I don't have shoes, I just have socks. So if you have a slick floor like a linoleum or a tile or wood, that's better than carpet. This works on carpet, certainly you could do it, but it's better if you have a little bit of glide, and you'll see why. Other than that, just minimal distractions. That's all you need. So the first thing I start out with is a toe spread, a foot and toe spread, and I just try to spread my toes out, get my foot as flat as I can, and then I curl it up tight. So I spread my toes and then I curl them in. And I'm trying to get just as flat and spread out as I can, engaging all those toe muscles. And then I pull it in and I kind of lift my arch, get my deep arch flexors to fire in my foot. So I just go all the way flat and all the way up. Kind of see how that feels, and that feels pretty good to me. So the next thing I do is I roll in and out. So I roll to the inside, very inside border of my foot, and then the outside border. And what I want to look for here is firing of my groin muscles, my inner thigh muscles when I roll in, and then my buttocks muscles when I roll out. So I want to start noticing up the chain a little bit here as I'm rolling that foot all the way in, all the way out. And then the next thing I do is I cycle around the foot. So I come to the inside ball of the foot, up to the big toe, out to the little toe, and sweep back around through the heel. So it's just like a big circle, and I'll just alternate. I'll do a couple on one side and a couple on the other side. Really getting some good ankle rolling motion there. So I check in with both sides, and sometimes I'll kind of alternate them and get a little bit more speed going. get my faster twitch fibers warmed up. We'll do more of that in just a second here. Then the next thing I do is I just come up on my toes, come up on my toes and back on my heels. As you see, there's a little bit of a balance component here. So I just try to come all the way up as high as I can, both directions, way up on the balls, but even past the balls, try to come up on the tippy toes of your toes and all the way back on your heels. Try to really lift tall. And then for a little added extra, if you want to do this, is to do it quickly. So I kind of come up quick, and I'll even add a little hop up on my toes. So I kind of hop up on my toes. Again, get my fast twitch fibers warmed up in the calf there. Now, if you want a little extra challenge, you can do it on one leg. So you can try to roll up on the toes, back on the heels, up on one foot. And if you want to kind of have an objective measurement, it's fun, is you can do as many as you can on one side and then as many as you can on the other side. And that's good information to know if you've got a weakness on one side or the other. And by the way, as we go through this, it's always good to kind of mentally log where your issues are or where you might have trouble. We're going to do some single leg standing in a minute. So if you have trouble standing on one leg versus the other, good to know. You always want to work your weak sides to try to keep as much symmetry as possible. But if you do have an issue come up later on that you need to seek help for, you have that information you can share with your practitioner. That's always very valuable when patients come in to see us and we ask sort of questions like, you know, what makes it better, what makes it worse, what do you notice is difficult, is one side harder than the other? And that information is valuable for us to help diagnose the problem going on. So make a mental note. Okay, so we did heel raises. So now we're going to work up into the knee. So I start out just doing, I call these butt kickers. They're just real basic knee flexion. Just trying to get that heel up to toward the buttocks. And then I'll switch and I'll go the opposite. So I'll go right heel towards left buttocks. And I'll also flex the ankle different directions. So I'll point my toes and then I'll pull the toes up and I'll do a couple at each position. Opposite side. See how that feels? And then I'll cycle, or I'll circle it around. So I'll kind of sweep inside to outside. And then I'll sweep outside to inside. So I'll do a few of those as well in the different ankle positions. Flexing my foot up, sweeping inside to outside, flexing my foot down, sweeping, and then the other direction. Okay, make sure I don't miss anything. So now we're gonna roll up into the hip. So I start out just doing a little pivot and really getting rotation inside that hip socket. And this is where a slick floor is real helpful. So I'm kind of up on the balls of my feet, the heels are up just a little, and I'm just twisting that hip socket. And I'm really trying to get to that end range, my end range. So just listen to whatever your end range is. And I'm really trying to get those hips just to rotate. Again, checking in to see how much motion I get. And I do have a little bit of stickiness on this right one when I go internal. But I'm also loosening up as I go. So that's a good one. Now the next one is we're going to do a big hip hike. So we kind of do a big knee lift and sweep out both sides. Again, just as big as you feel comfortable. And then I'll go the opposite way. So I'll go outside to inside. Okay. And really try to get that hip to open as you bring it in. Good. And then the last one for the hip is more of a dynamic exercise or practice, which is swinging the leg. So again, there's a little bit of a balance component. So if you need to hold on to something, that's fine. And so I start out just swinging straight forward. And then I start to change the angle a little bit. So now I'll start to swing inside and outside. My balance isn't great this morning. And then I'll swing outside to inside. And so I'll just change that angle as I go, and I'll look for different feelings, different tightnesses, and then I'll do the other side. So I start out straight, and then I'll kind of angle it inside to outside, and then I'll switch outside to inside. And so I'll just play with those angles a little bit and see, and I usually feel a tight spot at in this direction for me, in the front of my right hip. So I'll stay there for a few minutes and do that, and I may even come back at the end when I'm all done and do a few more in that direction. Okay, so now let's start working up into the pelvis and low back. So I start out just with very basic pelvic tilts, and some of you may be familiar with this move. But it's basically, if I have my pelvis, if I think of it like an oblong bowl, I'm just tilting forward and tilting back. Kind of pouring out the water forward, pouring out the water back. Okay, I like to think about my tailbone, kind of sticking my tailbone out and then tucking my tailbone under. And that helps me really visualize that kind of anterior and posterior tilt. So that's what I start with. And then I start to go, then I go sideways. So I want a lateral tilt. So I'm tilting that bowl. And for me, I like to come up onto the balls of my feet on that side. So I lift the heel, and I'm really engaging my core muscles. So this is where we're starting to work into the core of your abdominal area, low back. So I'm really feeling my quadratus lumborum, my lateral abdominal muscles firing. And I'm really getting a good hip hike. I want to look for symmetry. Do I feel like it's coming up as high on both sides? And then I'm going to add, I'm going to combine those two, the anterior, posterior, and the laterals, to do a big circle. So now I just do a big pelvic circle. Again, I try to think about getting each direction. If I have a clock, I'm hitting all those numbers equally. And then I'll switch directions and go the other way. And now I'm going to work into the lumbar spine. For the spine, if you think about your vertebrae stacked up on each other, I'm trying to get those vertebrae to kind of bend forward and then bend back. And so I'm envisioning kind of almost like a bow and arrow, and I'm bowing it one way and then I'm bowing it back the other way. So for me, I like to put my hands on my pelvis, and I just envision those vertebrae kind of opening that direction and then opening that direction. So I'm kind of getting them to bow forward and bow back. Some people call this arch and sag. A lot of people do this on their hands and knees, which is fine. You can start there. That's a good place to get some awareness of those movements. But I'm really thinking about opening those vertebrae forward and then opening them toward the back. And then I just work my way up. So now I'm going to work into the mid-thoracic spine. And that's more from the chest cavity. I'm going to open forward and tuck back. And I just try to work my way up. I envision each vertebra working my way up. And now I'm working up through the mid-thoracics. And as I get up into the upper part of the spine, I start to feel my shoulders engaging a little bit. And we're going to do the shoulders in a second. So I try to just do that for a few minutes or a few cycles. Now I'm going to get into the rib cage. So the rib cage is just about breathing, getting a big opening and then a closing. So the ribs expand when you breathe in and contract when you breathe out. So I just think about getting a big breath, breathe out. Big breath, open, close, open, close. And I'm thinking about two different movements. One is forward and one is outer. So I'm getting rib expansion forward and rib expansion outward to the side. And then I'm going to try to do one side. So I'm going to expand my ribs kind of forward and out this way and back in, and then I'll do the other side. So I lift, so it looks like that. Big lift, lower. So you see I'm kind of getting an opening and a closing. And I really think about getting as big as I can, and then I do the other side. And I feel some stretch on this right side. Even down into my low back, I feel when I open this right side, I feel a good stretch down through my latissimus dorsi and my erector, my paravertebral erector spinae muscles. So I lift, close, Really envisioning air just opening that right side of my lungs, getting those ribs to open and expand. So, excuse me. Now I'll get into the shoulder girdle. So for the shoulder, I basically think about rotating my shoulder blades forward and then back. Okay, that's a separate joint. We really have two different joints in the shoulder: the shoulder blade to the rib cage and torso, and then the shoulder, we call the glenohumeral joint, which is actually the ball and socket. So I start out with those shoulder blades, so I want to kind of get those to move forward and back. And now I use my thumbs to kind of see how I'm moving. I like to point them. And now I start to integrate shoulder rotation of the glenohumeral joint. So now I'm kind of going to get both shoulder blade forward and rotation in the socket. Okay. And then I'm going to bend my elbows and I'm going to slowly start to raise my arms out to the side. So I'm still getting the shoulder blades rotating, but now I'm rotating my arms and I'm coming up, kind of like little windshield wipers, and I'm seeing how far back my shoulders are rotating. Do they feel symmetrical? Again, checking in with those questions. A, do I feel stuck or stiff anywhere? B, do they feel symmetrical? And C, do I feel any clicking or popping? And occasionally I do get some clicking in the right shoulder. Got a past injury there. But today feels pretty good. A little stiff on the back side right there at the full external rotation for me. Okay. Now I'm going to integrate all those movements we just did with the torso. So I'm going to think about the pelvis and the spine, the ribs and the shoulder in one big movement. So I'm going to breathe in, breathe out. In. I'm arching the I'm tilting the pelvis, I'm arching, bowing my spine, I'm rotating my shoulders, kind of getting everything in one big movement. So I tie those in all together. Now the other cool thing is you can do one at a time. So if I feel stiffness like I did on my right side, I can actually do a one-sided, open the ribs and get the shoulder in a diagonal motion, and I'm really expanding the rib cage and I'm lifting that shoulder. Those are interconnected and they're definitely correlated. I have stiffness on the right side and I have a little bit of trouble getting full external rotation on that right shoulder. So this is a good way to kind of get those loosened up and opened up together. So that's kind of a combination movement. Okay. So that's it for the torso. We're going to move into the shoulders and neck. So I just like to start out just doing a few shrugs, checking in with my upper trap and those kind of tension stress muscles in the base of the neck. Those feel pretty good to me now, so I won't stay there. Now I'm going to start into the neck, and there's a lot of muscles in the neck. A lot of little ones, a few big ones. And so there's a lot of different mechanical movements of the neck, and so this is again just a kind of a 10,000 foot view movement practice. So this isn't meant to diagnose any kind of movement pattern faults or dysfunctions in the neck. But what I like to start doing is just little circles, and I start small, and I usually I'll pick one direction and just start little, and then I gradually grow that circle a little bit bigger. And again, I'm looking for symmetry in terms of the circle. Can I touch each number on a clock? If I envision my head rotating on a clock, can I get to each number equally as I grow that circle bigger and bigger? And if you have any discomfort anywhere or some catching or pains, certainly if you have any sharp pains, stop right there and just stay in that or just short of that painful range and work that for a second and just see if it loosens up. And that's what I'll do. So so big circle, and then I'll work back in slow, smaller, and then I'll go the other direction. So I start small, trying to envision hitting each number of the clock, and then I'll grow bigger and bigger. If I don't have any trouble, I'll go all the way as big a circle as I can, and then I'll work it back in slowly back to where I started. So that's my start with the neck. And then the last thing I like to do with the neck is a diagonal pattern. And this is a chin to armpit and then up and away. So it's down and in, up and out. And then I'll do the other way. And again, if you feel any discomfort, stay in that range for a few minutes. See if you can loosen that up. Neck tension, a lot of times, you know, of course these days we're spending so much time on the computer, but even in normal times, in non-coronavirus days, we're spending a lot of time sitting. And so very common to have problems in this neck and upper shoulder area. So these are great movements to do. I mean, you could do these just periodically throughout the day. So I think that covers most of, make sure I'm not missing anything here. Yeah, so that's basically the scan. Now I have a couple of, once I'm kind of warmed up, I have a couple of kind of combination movements that are just sort of fun, almost dance-like, that I like to add in just to kind of get my blood pumping and get me ready for the day. So the first one I like to do is just the twist. And for those of you who are, you know, who grew up in the 50s and 60s, you probably remember doing the twist. I like to do this because it gets this horizontal plane, this rotation movement, which a lot of us don't get much of. And I like to get my spine twisting, and I get my hips engaged, my shoulders are engaged. Sometimes I'll even add the neck, and I'll go opposites. So I've got my head going opposite direction of my hands, and it's a little bit of coordination too. So that's kind of a fun move there. And then the last one I like to do is I get into that shoulder rotation again like we did earlier, but I'll come all the way up and reach up and look up toward the sky, and then I come down and then I drop into a little squat. So this is just a sort of I call this a military press, down and then a little squat. And this just gets my hips, my back, my shoulders kind of warmed up and ready for the day. And I can do a little kind of opposite diagonal movement there, where I'm taking one hand towards the opposite foot. So that's a fun kind of combination movement there. And if you were going to do this before a workout, that could be a great little warm-up before you went and did whatever you're going to do. So thanks for watching, and I hope this helps you as much as it helps me. Take care and be safe.